Good evening, doctors. Hope we can start today's session. Today, we are having the third and last session of our webinar, Role of Homeopath on Treating the Autism Spectrum Disorders. Our faculty, Dr. Rekha Karnam Srinivasan, is an expert on the subject. I welcome Dr. Rekha to the session. I also welcome all our participants to this webinar series. Dr. Rekha, over to you, ma'am.
Yeah, good evening. Very nice to see you all again. Happy Navaratri. It has started 2 days back, and I guess all are having fun. I think I'm audible.
Yes, ma'am.
Am I audible?
Yes, ma'am,
Yeah.
you are audible.
Yes. So today I'm going to talk about treatment of autism spectrum disorder. The focus is on what can be improved, what can be cured, a framework for in homeopath. Here I want to talk about do's and don'ts during treatment, role of diet and regime. So first, at the outside, I want to thank my team. I have told so many times, yet to be released book on autism spectrum disorder, essentials in case approach management of ASD with homeopathy, a step further. So here I have my team, my mentors on the left side, and my contributors, my friends on the right side. So these are the themes which is in the book actually. But whatever I have discussed in these 3 days is not in the book. And whatever my team members have shared in other webinars, that is also not in the book. But whatever in the book, that is not has been shared. So I hope you will get the book, copy of the book after it is released, and you will understand the autism spectrum disorder in better way. There is a hope. And now, homeopathic choice therapy, how to approach a case in the most practical way. See, I want to tell at the outset, I'm not an expert in autism. I have uh, I have gone through so many cases and I have evolved with each step. And this seminar, webinars, all these 3 days, my point is whatever I have missed during the treatment of those children, and maybe it delayed the health, or maybe I could have handled them better if I had these uh, knowledge beforehand. And that's why I'm sharing my knowledge gain over these three almost. I have seen autism cases back in 2009 to 11 itself. And my first published case was 2012 in a Bhagwan Buddha Homeopathic Medical College magazine. So then I understood, oh, okay, I have started the journey even before I started compiling this book, that is in 2017 onwards. So what is the point? The point is I missed so many points during my initial years, and I didn't knew how to help them. I didn't knew what it means if to see a child with blinking. I simply gave the similimum or simile, whatever is possible. But if I knew, maybe I would have cut short the time by having better choices in therapy, management, as well as giving them other supportive help so that it will be far better for them. But definitely at the outset, I want to help give a big thanks to all my benefactors, my patients who have made me know few things about autism and how to treat them. So hope these things will help you in having better choices to treat your patient. So if you don't know the thing, you can't be helping. And the other way, you can be very happy that you are helping them by marginal improvements or one or two symptom improvements. I have seen certain places where they're celebrating like child started sitting in the class, child started speaking one or two words. He is talking in sentences. No, I'm not telling that that is not to be celebrated. My point is, what is in the overall improvement of the child? Is it quantifiable? Whether the child is improving, is it quantifiable? Yes, it is quantifiable. How? We have scales for that. And when we go on to see in the scale, and if the child is not as much improved as we thought he is improving, that means we can help them in better way, right? So think of these levels as starting point for understanding the diverse ways autism presents itself. See, even in a child, uh, even though the child's level of health is very good, they have very minor symptoms, but the impact on their day-to-day living or their classes or their schooling, that could be very big. If we, as a homeopath, interfere and rectify the small things in between, the child can have the best of its life, isn't it? So that is the point of all these things. You may have thought, oh, what nonsense, why we need to know about genetics and all those points in so much of detail. But I have compiled everything with a purpose. It's not like I want to show off that I know about genetics and all. See, I have studied about that in my own interest. Okay. Pure science is usually not very much appreciated because it is usually very difficult to understand, even for me, even for me. And then people think, how can we convert it into our daily practice? So it is not needed for us. No, that is wrong. Always, every further knowledge, every further in the whatever we give to our patients, no, clinically, that is based on knowledge. So knowledge is converted into day-to-day improvement in the patient we see. And that's what we are so gifted. We homeopaths are so gifted because our pioneers, especially starting from Hahnemann, Bowning-Hassan, and all the American homeopaths like Herring, they have put forth so much of knowledge, so much of knowledge. It's a big ocean, and we are getting benefits. So we are utilizing only part of it for our benefit. And you imagine if that knowledge was not there, how you would have treated your patient, isn't it? So that is the point here. Yeah, I am only compiling the knowledge so that it will be easier for you to understand the case properly. You see the points. Oh, this is this. So I have to need this. I have to do more investigation, or I have to send him to this therapy in that way. So that is the point of this whole exercise. And there are so much of help available outside. When it comes to knowledge base, allopath scientists are best. There is no doubt about that. They have put forth so much of effort day and night with so much of, they have got high IQs, high levels of brain. They have worked hard to compile all these things. It's not easy to have so much of knowledge base. If you remember, during COVID, whatever we homeopaths can help our patients was because we got the knowledge about COVID by continuous streaming of live research. Like research was going on, they used to update us, and it was becoming little easier afterwards. So first time COVID was very difficult, but second wave we had some of the knowledges like what to look for, what does it means to have a CT scan, what is very serious, what is manageable in that way. So we have other help like applied behavior analysis. This has been very helpful, or it is individual based. And I have helped the patients on uh, my level, like in my clinic. Like I will tell the parents to have, we can get the sheets in the online, where you can get the sheets where there is one particular irritating behavior, what happened before that and what happened after that. So you can write it down. And after some time, whenever irritating behavior has happened by the child or adult, young adult, so you will understand at previous day what had happened, or what he has eaten, or afterwards what has happened. So what is the consequences? So why he is doing, what is something is there and he is avoiding that in that way. So this has been very helpful because we can pinpointly understand what is irritating the child and why the child is behaving, instead of we are taking punitive actions like just scolding him or shutting him away or something like that. So that eases the problems of the child. In turn, it eases the behavioral issue. So these ways we can adapt. Uh, these are all by experts. As a clinician, we can adapt these. Speech language therapy, everybody knows. And social skill groups, they're all very good functional. If you know, then only you can send them to such therapies, right? So I usually guide my patients, if they are new, to do so and so things. Occupational therapy also helps very much. It's very, very effective. Educational support, yeah, one case where one boy of 14, he had a high level of problem, especially learning issues. And he was going to the school also, he was very, uh, his behavior was very odd, and he couldn't cope with the school. He had issues every day going to the school and coming back. I told the parents that you should help him to ease his problems. He'll be sitting for hours together in a corner. He was greatly helped with Bharataka. And then I came to know through them that he was now schooled in open school, NIOS. So, and then he completed his 10th standard in some way. And his sister also she's mildly autistic. She has some little gaps, and she also completed her education. So uh, they have been rehabilitated, isn't it? So they have certain things to talk about. They have certain things at hand. And occasional training, that is prepare for the future employment and independent living. Yeah, this is very important. And I guide my patients about this also. Especially in both the adult autism cases, I have been counseling them for rehabilitation or what they can do. I'm orienting them towards that, but ultimately that is their choice. I'm orienting their parents as. So additional areas of support, daily living skills training. It is very, very helpful, especially in the severe cases of autism. And then mild and moderate, they get much more benefit, right? That can be done by parents themselves. But severe cases in third level, it will be very important for having daily living skills training. Sensory integration therapy is also very important because, see, there is a very important uh, discrimination between children who don't want to put on the dress. It is a very common symptom among autistic kids, especially in level 2 and 3. We think of high eczema immediately, right? No, we may not be helping them with high eczema each time, because that is not because that they are shameless, they don't want to have the dress. It is because of the sensory issues. So we have to have the we have to know the difference between why the child is not able to put on the dress. And sometimes, no, children are very, very cautious about dirt. They don't like dirt at all. They they have despise so much that they don't go to toilet. You understand it? So we are thinking they are constipated. They don't want to go to toilet. Something like that. It is not the reason. They don't like dirt at all. So these cases, Cephalium has been very helpful in those cases. So we have to understand the background why that symptom is there. So each symptom can't be converted just like on the superficial level, right? So these are all few my thoughts about those things. So I think this will orient. And medications. Medications, especially in psychiatric cases and also residential care. This also you should be aware of. We have SCARF India in. I, I studied there, so I know that, and I am very much aware that it's a very good institution. So I have sent a few of my patients to SCARF India, and few have been not autism, but schizophrenia patient has been uh, rehabilitated in their facility. So this also you should be aware of. So these things I am orienting towards these things so that you will be aware. And Tourette syndrome, I want to talk about this a bit because it's not that rare as we think. So many times our kids, uh, autism kids will be shouting, in that way. And, or they will be running around, they will have high pitched without any reason, without any provocation. So we are not aware of Tourette syndrome, we'll be missing out points. If you can remember, I had shared about a case about a girl with tics, and she used to have that high vocal voice. Like suddenly she will start shouting in the mid of the night and something like that. She got help with Sanicula. So in that case, it was Sanicula. That does not mean every case will be helped with Sanicula. But anyway, I'm telling, then I didn't know about Tourette syndrome. I just gave medicines based on the uh, symptomatology. So Tourette syndrome is very common comparatively with ASD kids. So this can be, tics can be range from mild to severe and may change in type, frequency and intensity over time. And so the answer is typically occurs in childhood with symptoms often emerging between 2 and 50. Tourette syndrome is believed to be caused by combination of genetic and environmental factors, although the exact cause is still not fully understood. And then it's not solely defined by tics. It is a neurological disorder. And they may also experience with conditions like attention deficit, ADHD, obsessive compulsive disorder, and overlapping symptoms and challenges. So OCD also we can see in such cases, or OCD cases may have Tourette syndrome as well. So knowing these things, we will have power to help them. And social interaction, communication. However, there are distinctive features that can help distinguish between Tourette's and autism. Yeah. So you have seen such cases, right? Where children will having seeing the fan for hours together. They will be vocal in between. They will be shouting at a particular one point of gap between each sound. Or previously, I was not aware of Tourette syndrome, and but it has been helped with homeopathy very much. So I can recommend with homeopathic management, we can definitely help children with Tourette syndrome. Blinking, jumping, twirling, grimacing, eye rolling, shoulder shrugging. So they have some problems outside their house also because of this type of sounds and all those things. And it will be very a shame for the parents because they feel very bad when they take them to the public and children started grunting or shouting or doing certain odd behaviors. That will be very shameful for the parents, and it also affects the needs of the child because children want to get out of the house. They can't be in the same situation, and they can't be getting better. isn't it? If they go to the park and they're grunting or shouting or doing something, parents will start avoiding, right? So we should be able to help them with all the necessary knowledge and medicines as well, which is very helpful. And approximately 20 to 60% of individuals with Tourette's also meet criteria for ASD. And it requires a comprehensive evaluation by healthcare professionals with expertise in neurodevelopmental disorders. And then, yeah. So PDA, pathological demand avoidance. It's a profile of autism. It is a part of autism. It is not a diagnosis, just like virtual autism. Virtual autism, I didn't speak about that much, I think. We have a wonderful webinar by Dr. Ramya, who is also IHMA. She's in IHMA. She is in the book team also. She has given a very good, whatever comes, he will be seeing. If the phone is taken away, he will start having big tantrum, or he will be running around. Only two things he will be doing. He won't eat properly, he won't sleep properly, and he has become a problem child. But the child is very sweet, very sweet. He does not disturb who does not want to be disturbed. Like his grandparents, he never went to their house. They never went to their room. He never went nearby and never disturbed them. Only with father and mother, he will be showing tantrums. And he was backward in studies as well. Studies in the sense in pre-KG. And then you won't believe, with almost single Rustox and calcarea carb medicine, I didn't hear from them again. And then I was wondering, oh, this case is gone. They didn't come back to me. After 6 months or something like that, almost 1 year, I came to know that he's doing very well. His phone dependency is almost nil now. He hands over the phone and says, Amma, I don't want. I want to play outside. His speech has improved. He is doing well in the school as well. And she gives Rustox whenever he has cold, fever or whatever, whenever he is running around. So that is virtual autism I am talking about. Another profile is PDA. This is also not a diagnosis. It is a part of autism spectrum. Pathological demand avoidance. It's a very irritating thing, because even for a known person, it will be very difficult to handle, because the person is doing so much of you feel like he's doing too much over, like he is not at all understanding what we are telling. He'll be doing what he thinks is right. So it is a profile on autism spectrum involving the avoidance of everyday demands and use of social strategies as part of this avoidance. PDA individuals share autistic characteristics and also have many of the key features of a PDA profile. So they have detailed pretend, play and role play. Resist demands of everyday life. Like they can't ask for any help. Not at all. They can't even have a normal, regular conversation like, will you please give me that pen? They can't ask like that. They'll be just thinking around how I can get that pen. So asking is such a big problem for them. Resist demands of everyday life. Need for autonomy and control. They will say, no, I will take care. I will take care. Nobody come to me. I will take care. Everything they want to do alone. And it has very big problems, isn't it? No person in this world can do it alone. And then impulsivity are difficult with self-regulation. Sudden outbursts. Special interest. It may be a person, either real or fictional. Yeah. If you can remember that girl I had spoken about I am in between, I had a misdiagnosis as borderline personality disorder, but she could have autism spectrum. I was talking about. She had a special interest about Dhoni's wife. Yeah. And she had even tried to self harm. So that is so much of special interest about some person. That person may not even be aware of. Meltdowns or shutdowns from anxiety. Shutdowns are very common. Meltdowns are in children, but shutdowns in older people. Might be passive, watchful observer in the first year. Sensory differences, including sensory seeking or avoidance. Yeah. So these are all profiles. Asperger's, pathological demand avoidance, PDD, NOS, autistic disorder, and special language impairment. So I had shared one case about a boy who has now learning difficulty, right? If you can remember, the small child, but he has PD, pathological demand avoidance, specific language impairment, and he even pervasive development is also, his development is not up to the mark, but he has features of very slight features of autistic disorder as well, I guess, but not confirmed yet. So if this is there, other things may be there in that child. Every individual is different. Classical autism, Asperger's, PDA, ODD, ADD, dyslexia, Tourette's, OCD, SPD, dyspraxia, ADHD. See, it comes in a package, isn't it? Nowadays, we want everything in packages, like tour packages. Everything should be at one place. In autism also, we may not find everything in one place, but most of the times, yes, we may have the package. Yeah. So I have one person in my life who is very close to me, but she is not my friend or family. Guess what? Who could be it? Apart from friend or family, who is very close and into my life every day? Can somebody guess that? I think everybody is totally dependent on them. Everyone. I mean, ladies. Yeah, my house help, domestic help, and after starting this series only, I could understand that she has problem with asking help. And another point of addition I can do, she has born a child with hydrocephalus, and he is non-verbal, and also he is developmentally not up to the mark. So I think she falls into PDA profile, because everything starts from understanding that she is actually too good, and hence trusting her. Because everything, every day I have to tell her, like, I want this vessel like this, place has to be clean like this. Usually if you tell others one day, they will do the same thing every day, right? Not with her. I have to tell every day, each and every day, see, this is not proper. If you have to do. And it seems like it does not go into her head at all. And she feels very easily offended. So I will be talking softly, though I'll be so angry inside. I know her very well. She's a very trustworthy lady. So good, so good. I can't lose such a person just because she's not doing her job properly. And my girls are always, sometimes they will be angry. Ma, you are we are giving money, no, why you are keeping her? No, not like that. Uh, Certain things are beyond the explanation. She's such a good lady. And I understand her difficulties. I asked indirectly why she did that. Like, why you didn't complete this task? I had told you. I will ask in some other way. Direct questions, no, it offends her and she feels very bad. She'll not eat for 2 days. She's such a type of lady. Repeat almost every day what needs to be done. So this is the way we can support people who are having difficulties, I guess. Will you try that? You tell me in the chat box whether you will be interested in trying such things. So support people with autism or other profiles by understanding. Yes. And now diet and regime. We have this is the way. It is a bidirectional gut microbiota and brain axis. I think now most of the people are aware that gut is the thing which can be rectified, and that is the way to minimize the symptoms of autism, and it has a very, very great part in treatment of autism spectrum. And unfortunately, few children won't eat anything, nothing. Whole day I heard someone was saying this, whole day if you are not giving anything to him, he will not even ask for it. He will just carry on to the next day. So that is not aversion to food. It is that that is not at all there. Yeah, it's a difference. Okay, and you can consider it for early signs of autism as well. No asking for food. And then when there is prebiotics and probiotics, so healthy dietary fats, minerals and vitamins, omega-3, polyphenols and glutamine. And gluten-rich diet, where there is casein-rich diet, refined sugar, that will inflame the gut. So this is healthy gut. And it has been, most of the times it has been seen that whenever that autism child has some food which is not helping its gut, they will have behavioral issues and other things. Yeah, and homeopathy can totally help them in these things. You are aware of food allergies like milk allergy and Ethusa synapium, pulsatilla, those things are helping a lot, isn't it? In that way. Definitely we can help them a lot with advice as well as with medicine. Yeah, and there is about 70% of the immune system is in the gut. So imbalances there can worsen Lyme disease. I did talk about Lyme disease. It is also a tick-borne disease, which has been linked to autism, but the link is not very strong. They couldn't find it very strong link between that. Leaky gut also, these things have been explained, but we have no substantial evidence. So it's like, but symptomatically and as a homeopath, we can see the link. In the sense, we can help them, isn't it? So I keep it in between. Though there is no scientific evidence, if science is denying something, that does not mean that is not there, even including homeopathy, right? So we can definitely help those cases, and exploring those areas will be very helpful, especially in Western countries. I mean, non-Asian countries. This Lyme disease and all can be suspected. I think most of you homeopaths may be international as well. So you will be treated and you have to explore all the options. What could be the reason? Yes, Lyme disease and long COVID. This biosis or an unhealthy mix of gut bacteria can trigger inflammation, food sensitivities, difficulty swallowing, and even neurological issues through the gut-brain axis. Lifestyle and diet changes can aid the healing. So, how can I do? I help my patients that I am putting it here. First, you have to orient the mothers to change, because mothers are the pillar of helping the kids or whoever is in the house. That there is no doubt about that. Whatever we speak and talk about those things, that does not change the role of mother. And mothers are so much oriented to help their kids, but at times they are exhausted. They can't carry it on more. They have to take care of all the. See, for us, we have only that child to take care of at that point of. And we are focused on the well-being of the child alone. But for a mother, she has so many roles to talk on. She has to take care of the whole family and politics, that, these, and so many things. And we can't be asking them to only concentrate on this child. You give morning this sprouts, afternoon you give chapati, evening this nonsense. How can she cook for one child alone. He likes some things, he does not like some things. Whole family is liking something. It is not at all practical. So we should provide them practical solutions. So you first change the mother's attitude. See, you have to take care of the whole family. You have to include certain things which can be helping the child as well. Like if you are cooking for the whole family, it will be very spicy, right? Child does not like that. So you have to remove beforehand, before putting the spices. The after cooking, you have to remove little bit and then you add the spices. That way the child is spared and you are having less work, isn't it? And then you have to make it very simple for yourself. You should not be doing lots of things. Maybe you can do for 1 month or 2 months by diet charts, all those. Practically, it's not possible for carry it on for 5 or 10 years, isn't it? So you have to make, if you're going to a function or whatever, you choose the foods which the child can digest in that way. Or you carry it along with you and don't give any food from that function hall. Many mothers will do that actually. So, and you have to be very careful about homemade foods and freshly cooked, not refrigerated or reheated. That is the worst food you can give to anybody. Refrigerated and reheated, whatever micro oven, whatever you heat, no. One only for 3 to 6 hours, food will be good. If it is not good, you should not eat it. Refrigerated means frozen food is different. Uncooked frozen food is different. But still, it is not recommended. It's okay to some extent. But refrigerated cooked food is not good. And I always believe in Rojata Devekar. She has the best advice to anybody. She's a dietitian, nutritionist. So she always says, revisit your grandmother's kitchen. You take the wisdom from your grandmother because your get is based on your grandmother's genetics only, no? So you will digest only the foods what your grandparents had used. So that is the best thing I can do. And protein powders, it is very easy to prepare. Uh, I can give the tips about that if someone asks. And homemade type foods are also available. I have seen in a few hospitals, they recommend Geet Ganji and all. So Geet Ganji is like they have done like just like a homemade food. So that options are very much now available in market. Yeah, without preservatives or whatever. Yeah, and from the authentic source, you should be aware of that. And Ayurvedic dietary recommendations have been wonderful. So I had compiled about that. I don't know where I missed. There are very good for dietary recommendations in Ayurveda. And then prenatal nutrition is critical for the child's neurodevelopment. Nutrients such as iron, fatty acid, folic acid have been associated with neurodevelopmental outcomes. Autism is thought to be multifactorial, including both genetic and environmental contributions during the prenatal period, potentially a crucial window for autism development. So, I advise all my fellow young homeopaths, you should always take care prenatally or even before mother that lady is conceiving, especially about iron, folic acid, and B12, and also calcium. These things, okay, and good fat. Nowadays, people have started using 1 spoon oil, 2 spoon oil. Ghee is not good for health. This is totally nonsense. We need the essential oils very much, and it should not be fuming hot. That is very essential. That's what fatty acid. Ghee and natural oils are very, very essential, and it should be part of our cooking. And folic acid, iron may not be needed, but folic acid supplements definitely you recommend. Also, calcium supplements you recommend. Vitamin B12 also you have to recommend prenatally and even before they conceive. And homeopathy, biochemical medicines also will be very helpful. So, also, evidence suggests that beta carotene dietary supplement is very helpful for the neurological development. So, that is carrot, right? We get that much in carrot. So, they say 6 mg to 50 mg. See, basically, what I got from Dr. Tushar Shah, who was recently he was talking about vitamin B12 in the group. He says uh, all the vitamin tablets which comes in everything in one single tablet, no? That type of tablets are enough. We don't have to give separate for everything. Calcium separate, B12 separate, not necessary. And that is the minimum dosage that will be there, and that is enough. And another tip I got from another doctor who told 50 days dietary vitamin supplement, 15 days, don't take it. So you can make it alternate days or 15 days gap. If the patient forgets, fine, good enough. It's not that they have to continue. If they continue for 3 months, 15 days, that will be ideal. So prenatal, natal and postnatal, they have to take dietary supplements in the form of tablets. Please don't miss that, especially B12, folic acid, thyroid medication as well, if recommended by the doctor, and as well as what I told, B12 and calcium. So these things, don't compromise on these things. Don't say we will compensate with homeopathy. Better give them supplements and applying medicine. Now, how I apply usually. See, everything is based on my own cases and what I have read and studied, and that does not make me an expert, because nobody can be expert in, especially uh, in homeopathy, where it is everything is individualized, right? And I usually give in water dose, especially 1 pill in half glass of water, 1 spoon of the medicine. That is my standard procedure. And few patients are very sensitive, low susceptibility, high reactivity. That is seen in autism kids. They are so reactive. Even small application of 1 pill, doom. It will just change the whole scenario. And parents will stop homeopathy altogether and they will recommend everybody never ever go to homeopathy. That they will have so much of bad experience I have in few cases. So I go by divided doses, or 1 pill in 1 glass water, 1 liter water and 1 spoon only, that way. And even externally applied in very sensitive cases, or even smelling also for immediately. So these all things have helped. And if aggravates, but still helpful, change to weekly once what to do. And skin root and also nasal root. Very, very hyper sensitive. And how you evaluate whether they are improving or not? I usually use autism ATC score. It has been very great, and seeing whatever is not improving here in this, okay, that I give medicines for that specially. Like speech and language need to improve, comprehension need to improve, I will leave that. Or physical behavior, I give that in that way. So tailored for their needs. So ATC scores, you can put the all the details in the online itself, and they will send you the report through your email. You can do that, or parents also can do. Yeah, tackling specific histories during treatment course and few remedy suggestions. Individualization is always recommended. Constitutional is different. I am a Silesia constitution, but I have not been benefited by Silesia anymore. Okay, so individualization definitely helps, not constitutional. So I think there is little bit confusion about that, but this is what I believe. So always individualize. And for head injuries, always already about remedies. And hypoxic injuries, nowadays I have been helped with vanadium 6 China, Carbovate, and also other drugs. So hypoxic injuries has to be treated. And then infectious diseases like encephalitis or meningitis. It's a very big treatment procedure. But as you know, belladonna, Rux, even tuberculinum, I have missed here. That's what I told based on my cases. But tuberculinum is a very important remedy in encephalitis or meningitis. And then dengue, chickenpox, mumps, measles, after which problem was observed. Repertorium perk for dengue, past history at some point of time. It will be very, very important for dengue. Wherever there is headache prominently, you think of Epitorium perk, Baptisia especially, and then Bryonia. If Epitorium is not helping, you can give Baptisia. If that is not helping, you can give Bryonia. Or you can reverse also. Because that's what I have seen. Body pains and headache, Epitorium perk has been infallible. Yeah. I like Pulsatilla, Variolinum, vaccinum for chickenpox or measles or mumps. Yeah, that also is needed. And I had shared one case about mumps, right? Not we have it is in the process. So I guess potentially it has been that child has been helped not to getting into a bigger problem because he had a skin infection, right? You understand that? Wherever there is a skin infection and if it is not suppressed, they will have a very good life. Yeah, typhoidinum for typhoid history, China, Natromur or malaria is for malaria. It could be even typhoid also, China, Natromur. And these are all, I have only given few suggestions, that is not exhaustive list. Vaccine damages, acquired ASD. Yeah, Tuja, Silesia, Califas, Hypericum, Ledum, and other things also. Califas has been especially helpful in babies where below 1 year, where they have a vaccination and they will have fevers. They'll be helped to reduce the fever as well, and it will prevent the bad effects of vaccination. But it's a very big thing in itself, vaccine damage. So you can even watch my my thoughts about vaccine, especially COVID, no sort vaccine and no sorts, and it's available online. Yeah. In vaccination, specific no sorts are available in homeopathy or tautoparathic specialists. I will ask you to study. Yeah. And COVID and vaccine has been so good, very, very helpful. DTP, pertussin, pertussin I have used, DPT not much used. And again, it depends like COVID has been very consistent in results. But not that Meladrinum also has been helpful, where after COVID vaccination, the child developed chickenpox. So many cases we saw that, no? Chickenpox and Meladrinum or Morbillinum. Morbillinum 1M has been very helpful. And COVID and vaccine, yeah, that also very helpful. Very, very consistent results with COVID vaccine. Maternal stress factors, we had spoken about this. Yeah. And then these factors help in determining child's personality. So treating the mother will be a great benefit for the whole family. I want to tell about one case, very briefly I will tell. I was approached by someone for his wife's problem. And actually, they didn't give much details actually initially. But as I moved further in that case, I could understand that she has a personality disorder. That is paranoid personality disorder. She has lots of doubts about her husband. And he thinks she explained one thing. They were standing in a mall. One child came and she held his hand and looked at him. She mistook him for her father. And then she realized it is not her father, and that child 4 or 5 years old, she left. And this lady was bombarding him with questions. Who is that child? Is he your daughter? Something like that. You can understand, no? She is paranoid. And her son is 17-year-old and he has autism spectrum disorder. So you can understand the link. There is mother has some psychiatric condition and child can be having ASD. Another case also I spoke about, he is non-verbal and the child I treated, I had spoken about that. That lady during pregnancy and before pregnancy, she had OCD and was on psychiatric. So these things usually guide us to think about few remedies as well as management. So Calcarea group, especially in financial crisis, mother is worried excessively during pregnancy. Ignition at tremor if neglect or fears are present. And that lady I told, no, OCD with psychiatric medication, she was very much helped with ignition. And her son with life coach. Kali group if mother was depressed. So it is very broad way I am telling. That does not mean that these are the remedies for all this. Yeah, and this thing I had compiled for my own thing, and we have almost spoken about these things. And each of them can be helped with homeopathy to some extent. Whatever can't be helped with homeopathy can be managed with other modules, just like how whatever I have shared before now. And especially in learning disabilities, homeopathy has been very great. And also intellectual disability, not much improvement, but definitely they will be more manageable. They will day-to-day activities will be better and they will take care of themselves. Their mood, tantrums, everything will be better. They are more, what to say, more sociable now. So you can take them out there into the park or the family function. So, and developmental coordination disorder, epilepsy also, homeopathy has a very good role in preventing and even curing epilepsy in so many cases. Um, like even when we see a child having anger and or febrile convulsions, it may not amount to epilepsy or it may not get into ADHD or autism. It's not that, but definitely if we can tackle them at that point of time, maybe we can prevent such happenings. Because so many things, so many times we see that the child, I think I shared that case also in previous thing. He was so much of anger and tantrum, but that is common for that age. 2 to 4 year age group, child is showing tantrums. You should not jump to conclusion that she or he has having autism, right? We should have the discretion, but definitely the traits can be tamed down. That we can stop them from getting into label. That is what my point is. And hypermobility also, we saw a case about that dystonia. He is a normal child. He does not have any problems. But I made sure that he is a normal child by ordering for few more tests. Yeah. So that is very essential. If you know only, you can order for test, right? Previously, I was not ordering much test. I thought it is like looting the patient at this one because patients can't afford it. It will be very difficult for them. Now my perspective has changed totally after COVID because if we test that, if we order for the test essential for that case only, we can help them in a better way. We were not knowing what is there. Mostly we will be missing the points and we'll be beating around the bush. Not the exact cause, but we are just trying to manage it. It is a haphazard way. Yes. And the tics Tourette syndrome, we spoke about that and very good results with homeopathy. and motor delay, difficult gaining weight. Yeah, see, difficult gaining weight. It is such an important thing, but we will usually don't think much about that, right? But difficult gaining weight has been helped with China and China group of remedies. I always where there is unexplained loss of weight without cancer or whatever, tuberculosis, whatever. China has been very handy. So you please consider it. Okay. Short stature, micro and macro suicide. Mental health, anxiety, depression, bipolar disorder, psychosis, obsessive compulsive disorder, PTSD. I think you can understand all these things can be very well managed with homeopathy, helped to much extent, but it depends on the severity of the illness and other factors as and dysregulation disorder, hoarding disorder, conduct disorder, oppositional defiant disorder, and then sensory and GI, sensory processing disorder. It's a very common thing, but it is very difficult to manage. We have to have many modules and tips and tricks we have to have to manage those children. Yeah, gastrointestinal issues, we spoke about that, deafness and hearing loss. So this first we have to see. And fibromyalgia, Ehlers-Danlos syndrome. Yeah, this also that is hypermobility. Selective mutism. I want to talk about selective mutism. It is just like PDA. It is a profile. It is not a diagnosis. Selective mutism is the child is very normal in all other circumstances, child or adult, young adult. But when it comes to talk on a stage or something, they have to present. Suddenly they will stop talking completely. They can't talk at all. So something holds them back. They can't be normal. They are so anxious inside. And that is selectivity. They don't talk at all. And they will hide. And how much efforts you do counseling, you give training, that this and all, that does not help. Those children those people will be having lots of difficulty coming out in public and talk. And this is just like you can think about homeopathic remedy profiles, right? Like argentum nitricum or lycopodium or calcium. And it can be completely helped with homeopathy, completely cured rather, if it is the only thing we are seeing in the child. So knowing this, no, it differentiates between the child's mental capacity and mutinism per se, where there is a global non-verbal thing, or only one or two words or one or two sentences. But selective mutinism is only mute at circumstances, and it can't be helped with other modalities, as I can see. Even cognitive behavior therapy has very limited help in these cases, but homeopathy can help them very much. Yeah, and all these things are conditions that can be seen alongside autism. So we can have to treat them individually so that the whole thing can be settled. The child can be having the maximum benefit. Coexisting psychiatric illnesses have to be considered and treated according to the norm. Psychiatrist opinion is sought if some unusual comes up, and schizophrenia and other illnesses has to be homeopathy roles to be defined as well as beneficial due to advancements in the knowledge. So we should try to treat trichotic carriages along with other symptoms if possible, and with homeopathy alone or with psychiatric medicine as well. So it depends on the case. So speech therapy, I have seen it helps very much. It is very good result along with homeopathic remedies. Many times I have used Agrafis Nitasin 200. It has given limited amount of benefit, but still it can be tried. And zinc group remedies have been very helpful. Rustox helps to settle the child. Yeah, and even sensory issues. If the speech therapist pulls the face, no, and he moves the mouth and all, the child will be very irritated. They have sensory issues. That can be tackled with zinc group, even cuprum and some other metals, where they are very sensitive to touch. Carcinosin, that. Yeah. Remedies for delayed milestone, Kali group, especially Kali brome, where their hands are very active and they can't sit still. They'll be doing something with their hands. They will be pulling that this and all. And their hands are restless, zincum mode. Zincum, I told. And both they are jumping around and climbing, jumping. Phosphorus you can think of, and even tuberculin, right? Yeah. Natrum group, very helpful. Calcarea group, very helpful. And Barata group. So these are all based on my cases. Okay. I already told it is not an exhaustive list. It is only based on my case. Yeah. Sensory issues. Yeah, I told. And to be avoided, specifically medicinal, except psychiatric prescription drugs, has to be avoided. Especially memory enhancer, herbal supplement, chelation therapy or biomedical therapies, as it is my knowledge. I have seen along with homeopathy, if they are on antibiotics, see, there are so many parents, no? They're very super conscious. They're very afraid, they're very nervous. And if the child gets fever, even 9900 Fahrenheit, they will start giving paracetamol drops and all. And that hinders the curative process. And it's so much of time. It's a very big problem. That's why I had put that poll, whether parents or one reason for the non-improvement of the autism kids. It's a very, very big issue. And it's very difficult for us to educate them that these things are hindering their complete cure. They can improve much more if these things hindrances are not there. I have seen one case where she was coming up so well. She was going to school. Her eye-to-eye contact had improved. Her speech improved. Everything was coming up so well. Suddenly, they didn't contact me for almost 3 months. When I asked them, they told, "We are going to a herbal treatment. It is only memory enhancer, like something like Brahmi." And they told some relative had forcefully told them to give this one so that her brain improves. And you understand, the case come to the square one. I felt very bad. What to do? And have to warn them beforehand not to use aloe vera, no herbal supplements, no weight loss herbal supplements, no such things, not allowed. You have to explain. Say, if you give them, homeopathy stops working. That way you have to convince, because it is bombarded with the WhatsApp University, where they have get so much things and they want to try everything so that the child will become normal suddenly one fine day. It's very difficult for you to explain to them that child will not become normal suddenly. It's not a possibility. It's a continuous process. It's a continuum of everything. Child will improve stepwise, and we have to keep the pace with homeopathy. Especially homeopathy is the best way to have the continuous improvement. Continuous improvement. And they don't go back to the original state, even they stop functioning. And this knowledge is very, very essential. That has to be given to the patients. I don't know others how much you follow up. My patients, I have followed up for almost 20 years now, 26 years also. Minimum 5 years, 8 years. This is the follow-up I have been getting, and then I think that explains, right? If you are getting only once or twice and you're not getting follow, you don't know what's happening, but you have to keep pace. And then antibiotics is a very big problem for homeopathic medicine. It stops working. So many times I have seen, and you have to educate them. And even if you have to give antibiotics for some reason, like the child is suffering from pneumonia, sometimes we can't alone handle such emergency cases. And so many times, even parents' apprehension, we have to see. We can't be saying, no, no, you can't go there, you can't do this, you can't give that. We can't be in that mode. We have to be accommodating. So we have to tell them, even if you are giving any treatment courses, you be with homeopathy. Don't stop homeopathy, or you start immediately after that course is over. You keep me updated. Everything you are doing to the child. Yeah. Toxic poisonings, if detected, best is potentized homeopathic remedy, right? You are aware of lead, plumbum, arsenicum, and aluminum. Alumina, it's a very big thing, because most of the working class people, they use aluminum vessels, right? So we have to aware of all those. Yes. Antidotes should be prescribed in the course of treatment if supposedly interfere. Fetal alcohol syndrome. I haven't seen much, because India, at least I haven't not come across. But definitely you have to consider all these things for knowledge. Yes, syphilinum 1M, Naxomica 30, repeated daily dose. It has been a wonderful. Most of the cases, alcoholism cases, I have dealt with this. And even if it is fetal alcohol syndrome, you can go for these remedies. And then nitric acid and sulfur iode, this can be very helpful. And behavioral issues are difficult to handle, yet not impossible. So ADHD are very, very helpful with few doses. As I told about virtual autism, no? That case. Yeah. It can be achieved with team effort, with consistent effort. Team means ourselves, the child and their parents. If some needed, some therapy. Psychological treatments also not much helpful practically, but multidisciplinary action has been promising outcome. Yeah. Hypothyroidism, especially maternal factor, to be specifically treated with or without prescription drugs. So it has to be taken care. Remedies with iodine can be thought of, like sulfur iode, ors iode, or calcarea iode, ferrum iode, natrum iode, and also brome, ors brome, ammonium brome, ferrum iode, natrum brome, especially where there is anemia, and also barata iode, and other remedies can be thought of. Yes. For aloofness or blank state, it can be tried if no improvement noted after constitutional remedies, or did not improve specifically after in general improvement. So magnesium group, magmus, sanicula, natrum group, nuforlutinium. I had read somewhere some article about that, and I tried it, and it was very, very helpful. The child is like it's in its own world. I mentioned that in the case of 4.5-year-old boy, I think he was humming and singing all the time, but non-verbal only. But he'll be humming like in that way. Even in the clinic, he sat somewhere and he was singing himself. Okay, that case I had given nuforlutinium. Some wonderful articles are available online about nuforlutinium. You go and study them. Oxygen, neon also helped much in few cases. Androctonus, that is scorpion, helium, and mandragora. So when it comes to remedies, I will tell how I study. It has been a continuous process of almost 20 27, 28 years. So I study when I come to know about one remedy, I will go and study that whatever is available about that in the all the textbooks, and also I go to online sites where there is authentic knowledge, and then I study their how they behave with case examples and all. And I am a George Royal fan. You know George Royal. He has written very great books about how to study a symptom and how to study a uh, materia medica and all. So, and his book on neurological disorders also is a great book. I have been utilizing that for long, and very comprehensive and very practical only. And he says you study the remedy by taking it yourself and experimenting. And I have been doing that for since my college, and it has been. I don't recommend it if you can't bear the consequences, because I have been quite a lot of difficulties after taking such remedies. Especially, I can never forget the Lachesis depression or platina depression. Oh, it is just like, oh, even now I shudder. Okay. So it's not like proving. I don't prove remedy. I will take only one dose or two doses, and I will observe whole 1 week or 10 days, how I feel or whatever I am doing, what is better, what is not better in that way. So, but be careful, huh? Don't experiment without able to see the consequences. And this is for aloofness and blank stare. China, Bufurana, Barata, Mancinella. Yeah, I will talk about few remedy profiles also. Germania metallica, where this anger is the top thing. And calcarea mood and gallic acid. Gallic acid is for sibling rival. And then gut issues. Bismuthum has been very helpful in these children. They vomit immediately after the food reaches the stomach. You are aware of that symptom, right? And also taraxacum with mapped tongue and nil appetite. And colchicum when the child gags while eating. So especially after allopathic treatment. Or sulflavum for nil appetite and first morsel brings gag reflex. And croton tiglinum, aloe sarcotina and pulsatilla have been helpful in milk allergy or desire and aversion to fatty foods. Podophylla, room especially child will be very nagging. That will be holding on to the mother always, uh, like not like pulsatilla. Pulsatilla will be weeping always. This room child, no, it will be something like always nagging mother. So they can't be quiet. They want mother and they will be nagging. And similarly, mangrove and Sina and chamomile. So mangrove, green stools. You understand that, right? Yes. I haven't explained all these things. You know very well. Bowel nosers, I have very less knowledge, but Proteus has been very helpful, especially when the child is very clingy, which is demanding, pulling the mother or pushing the mother always. It will be around the mother or father, whoever it is attached to. She or he will be climbing on the parent. They won't let the parent to sit down. They will be always demanding. They will just ask something. You come, you come, you give me that, you give me this. It's a very irritating child. So that type of child I have helped with Proteus one name. It has been very helpful. Yeah. Genetically altered cases with mutation, deletions, or cases with strong familial psychiatric histories of schizophrenia and psychosis. Very less or no improvement, but we may have some good news for them also. Rehabilitation is more important. And brain morphological changes in ASD and schizophrenia is supposedly very similar. So that is poor prognosis. Trichotillomania, I think I had spoken about this, and belladonna has been very helpful. But this is basically you have to calm down the child or whatever. Yeah, high functional autism or mild to moderate on ATC score range cases have more hopeful outcome and approached one step at a time, shorter follow-up timing, so that progress is gradual, non-stagnant, but unhurried. And then remedy profile, Mancinella, they have a delusion that devil has come up again upon them, and it has been very helpful in these cases. I use Mancinella 6 repeated dose, and sometimes whenever there is some tantrum or some anger issues, that time I will use Mancinella. Mancinella is also having skin issues, so you have to study that also. There is Pinata, one case I told, I think, that child was always hitting and pinching, pulling her mother, and sometimes he will take the knife also as if she will stab. This indicate they have that knife disposed to strike and invades against the dearest friend. So that is her mother only is the target always. That child was many times helped with that is Pinata. Tulsi. I had sent them, so they gave that Tulsi. Whenever it happened that she wanted to injure her mother. So it's a renew remedy. I studied from Dr. Vishpala's teaching on there are wonderful lectures on by Dr. Vishpala Parthasarathy, late Vishpala Parthasarathy, and I will recommend you to go to the knowledge source and learn more about that. There are so many wonderful websites, YouTube channels in homeopathy section. You go to the authentic one. I usually go to even Dr. Gaurang Gaikwad's lectures will be very helpful. And so many lectures are there. All legends also. They teach very well. So I'm improving my knowledge. Falcon is a very new remedy for me. I never knew. Recently, I have been studying all these things. Falcon, especially I have seen them. They are very moody and they want to go and lie down always. And also they want to get above the problem. See, if you are doing something, they want to go to the next level to avoid that rather than succumb to it. So I have already mentioned about the adult autism case where Falcon had been helping them, isn't it? Cobaltum especially jerks, and there is a need for support like Calcareca. This is my empirical knowledge. So jerks, I had helped a case very much with Cobaltum 6, and you can use it in cases of tics as well, if it suits. Jerks not amounting to seizure. This is also in Rostov, bile sleep, first sleep, and Zincum, Cuprum, all many other remedies are there. But Cobaltum also is added to my repertoire. And then Mandragora, this case, she had, what to say, clairvoyance. So, another few of the other symptoms were also there. So that I prescribed her Mandragora 1M and she improved a lot. Her clairvoyance is not there now. Like she used to have the whole vision about that happening, and it was very painful. Now that is not. So I have one link about Mandragora. I will send in the group. Calipronome, I told about this. Luna, abrupt, aggravated moon phases. Luna abrupt is a very important symptom, but you have to study it in deeper sense so that you can understand and you can use it in your day-to-day uh, day-to-day cases. Labs has, I don't remember where I had heard that. Labs having that something will burst, something sensation. They will have apoplexy, right? And that bursting sensation, headache or something will explode. And one case, actually, I was thinking all these years, it is a bipolar disorder or something like borderline personality disorder, something personality disorder, I was thinking. Now, after starting this learning phase, no, I can understand she is not in that phase. She has addictions of sleeping pills. She wants to always want to lie down. She wants escape from this whole world problems. So she was having that urge to take sleeping pills, 10 to 12 per day, and not that much, but morning 3 or 4, afternoon also she will take in that way. So it was an addiction. And then I treated her, and she was so well for 2 years. She improved with nausea. She had severe headache. And then all other features also. She is not a sociable person. She don't want to be with anybody. She wants to sit in one private space. And I think she had lots of ASD features as adult autism features. But I couldn't grasp that. Recently, she was telling, I have that feeling of gas cylinder will explode. Something will explode in the house, and I am very scared. She's always a anxious type person. And this point, I gave Ella, and now I didn't hear from her for more than 3 months. When recently her husband spoke to me for some other reason, he was telling she is good. She has no problems as such now. Yeah. And then Ambragracia, this case, I have been treating for 2016, and she was having so much of tantrum, so much of difficulties. It was like whenever someone comes to her house, she will start beating her mother, or she will start pinching her, or bite her. Even some person to repair something, and she don't want to go to the school. She will have tantrums, and uh, she don't even go to the toilet. Okay, she will go to the toilet only at 12 midnight. It's a very strange thing, but it's very difficult to change. It is not at all possible. And if she goes out of her house, she won't go to toilet at all for 3 or 4 days. And then I couldn't give her Ambragracia for some other reason. I couldn't send her the remedy. And they couldn't get it also. Recently, they got the remedy, maybe 6 months or 1 year back. And then after Ambragracia, she has become totally all right. Totally all right in the sense, totally manageable. She sits down to therapy. She is not throwing temper tantrum in that way. And her diet, appetite, everything is better than before. So it was been so difficult. Now it is far better. So they have that awkward and disgust or filthy feel. So another case also I have given Ambragracia. I am waiting for the feedback. Hydrogen, these remedies you better study in sensation method. You get lots of what to say, the overall how to uh, pick those remedy traits in your cases. So these things I have been used in my cases, and I have helped them with much of improvement. And lack remedies also, you will get lots of knowledge about this in sensation method. And also there are so many speakers, genuine speakers, authentic sources and you have to improve your knowledge in that way. So, prebiotic fecal microbiota transplant has been recommended, but it has been told that it is not that effective. Even it's just like immunotherapy. Even during COVID, no, they had what's so hyped about immunotherapy by autoimmunotherapy, like that antibodies they will remove from the healthy person and they will inject, and actually it didn't work out as they thought. Same with fecal microbiota transplants as well. It is only a way out. We have certain so and so things there on the platter. You can try it. Whether it helps or not, God knows. And that is also true with cell therapies and regeneration of stem cell therapy and all those things. No substantial improvement seen in the practically, but on paper, on research and all, it has been very colorful. We have to yet to wait and watch. Yeah. So these are few thoughts for when you are dealing with such kids. The child understands 1,000 times more than they can express. So, listening and taking in what you are saying, even if they are not always able to respond. So, you have to always keep that in mind. You think it is like a piece of furniture. I mean, you means not the doctor. General public thinks autism kids can't express. So, it is like a piece of furniture. No, it is not true. They can understand 1,000 times more than what they can express. There is a gap. So you have to be very sensitive and sensible when dealing with such kids. Most autism therapies, approaches, and learning environments overlook or ignore the importance of reducing demands. Demands in the sense that is not common thing for us. We can manage all those things, but that will be very difficult for the autistic kids. Like eliminating sensory overload, like colorful lights, color papers, so many things crowded. Those things are making them very odd and very difficult for them to grasp such things. So better you have to avoid such. And then understanding the unique learning styles of the autistic student. So this is helping us so that we will understand that child is improved after homeopathy because they can bear such. They can wear the dress. They can wear the colorful lights. They can go to the public places. They can hear and still they can assimilate it. So these are the ways you can understand that is helping. We are helping our autism kids with homeopathic remedies. If not, we can help them in that specific area. When they tell me you must have a lot of patience to work with autistic children, and I replied that it's nothing to do with patience and everything to do with being present, loving, and caring. So patience means you're waiting for the train to come patiently. Actually, you are frustrated. Okay, you can't do anything about delayed train. You are patiently waiting. So that word patience means you are not with that situation. You want to escape from that. So here the point is you have to have a rapport with the child also. May not be initially, but as the time goes up, if you build a rapport with the child, then only you can give 100% to the child's development. And that will be very helpful for the mothers as well. So you have to understand the nuances in between. And then individuals can read your attitude, right? And are more likely to move away, shut down, or push against your attitude when you are uncomfortable, distracted, or need them to be different. Yes, don't you have to in sync with their sensibilities. You should have to be in sync with them. You have to have appreciate what they are, not mold them what you want to. So those things will be very helpful. These are all small tips, but in this area you are working, it will be very helpful. So now I have a small thing like taking the case with the reference to IHRC case record pro forma, repertorize and analyze, as well as planning the treatment according to the problem, and immediately dealt with like aggressiveness or gut issues. Improvement noted, but no further breakthrough. Consider all other factors and diagnostics which may be hindering the progress, like infections, maternal factors. General health improvement, but specific areas has to be tackled which are not improving by the present remedy, like learning difficulties, bedwetting, or speech. Remedies according to specific symptoms added and continued, which helps like to be anchor or restlessness. When status quo reached, again go for the case taking, may not be with the pro forma, but brief but detailed case taking. Again, repertorize, analyze, improvement noted, and then continue the till that child is rehabilitated. Maximum has been reached from the child's well-being. And then I want to thank IHMA for providing me such a wonderful opportunity. Especially being an IHMA, I am very proud to be here talking to my fellow homeopaths and sharing whatever knowledge I have gained over years, especially about autism treatment. And thank you for being here and showering me with so much of love and through your interactions, your views, and also by voting in the poll also. So now, after all these things, I think you can understand what is the trajectories in autism spectrum disorder. So how we can go about in such cases, what and all things has to be thought, kept in our mind when we are dealing with such cases, and for the maximum benefit, what can we do and what we can avoid. And I think, especially for young homeopaths, seeing the trivials of homeopaths, especially who are very senior, like 2 decades and all. When I started, it was 10, 12 years of my practice, right? So you see my trivials and you can understand it has been very tough at times, but definitely that gives you the power of knowledge, right? So whatever I have told you, if it is in the background running, you are better equipped to grasp the things. Because when autism was becoming popular at that time, that is 2010, 11, at that time only it started becoming popular, and there were very less modules available. And then they picked up very drastically after 2016, I think. And whatever we have gained expertise and all those things is because of the knowledge base done by pioneers, especially Dr. Praful Barwalia's peer-reviewed articles have been wonderful. I have been keeping them on my table. And Dr. Anuparani's about learning disabilities, that also I keep on my table. So why I'm telling is, they have given us a very, very good guidelines. How can we go about in such cases? So many knowledge is being added every day, but that does not change the core. We have to help our patients with the things which are basics in homeopathy, right? So with this note, I want to only talk about whole. Now, after all going through all these things, what is your opinion? So I had put the poll like, first thing is homeopathy inability. Patients and parents are not following instructions. other factors like genetics, miasm, and infection. And parents, second option was parents seeking every therapy told to them desperately, not following what homeopathy say. Other factors like genetics. Third option was homeopathy inability. And the third in that option was other factors like genetics, miasma, and infection, and levels of health. Second is parents seeking every therapy told to them desperately. Now, most of them have voted for B, but I think that is C, because parents are desperate. They run around wherever there is something, some help available. But the thing is, first thing is genetics and other factors, because autism is a big spectrum. And then if they are helped with homeopathy, mostly they won't change the doctor or the therapy unless otherwise. And then second one is parental desperation. And I think third one is homeopathy inability. But it is remediable, right? First two things are not much remediable by homeopathy. But third one, yeah, homeopathy can take care of. Yeah, good luck for you all. Thank you so much for this wonderful opportunity. I think I have spoken much beyond my
Ma'am,
time.
Ma'am, there
Yes.
is one question.
Yeah.
Have you seen any cases where the mother or father have taken COVID vaccines?
Yes. Lots of cases where COVID vaccine, like, but the question I couldn't get it properly, because COVID vaccine.
I think the doctor has asking about whether COVID vaccine are causing autism.
Yeah. In that way, see, we
Uh,
have to be like, it's a very recent thing, right? COVID vaccination. So I can't tell in that way, isn't it? But vaccination usually have impact on the child. And after vaccination, many children have suffered, as I previously told, with epilepsy or with seizures. And in autism cases, it has been worsened after COVID. But children have not been vaccinated, luckily. But
no, ma'am.
those teenagers,
What about
yes.
parents who has taken COVID vaccine and having children after that?
Yeah, but see, the question is tricky, because during the COVID, I have treated few ladies who have taken COVID vaccination as well. But since I have treated with homeopathy, maybe they didn't develop ASD. See, if I am there in that point of time, I mean, homeopathy is there at that point of time, that will definitely not let the baby develop like ASD, isn't it? Maybe in one case I told, no, baby of 9 months, she has no eye contact, and other factors were seen, like early preterm birth. Their parents had taken vaccination, both of them. We can't correlate exactly with this with that. That I can. But both parents had taken. Her father had COVID as well. Mother had taken the vaccination as well. Maybe that could be one reason for the child's delayed development, along with other factors.
Doctors, anyone else have any questions? Ma'am, I think we can wind up the session.
Wind up, yeah. Too much of. Sorry.
I am Dr. Jagadi, convener, National Women's Wing of IHMA. And on behalf of National Women's Wing IHMA, it is my honor to deliver the vote of thanks for this final session of our webinar series on Role of Homeopath in Treating Autism Spectrum Disorders. This has been an incredibly insightful and moving journey. I want to begin by extending our sincerest gratitude to our speaker, Dr. Rekha Karnam Srinivasan. Your dedication to sharing your knowledge and personal experiences have been invaluable. We are especially grateful for the case records and notes you have shared with us. Your expertise and compassion have profoundly enriched our understanding and left a lasting impression on us all. To our entire organizing team, a huge thank you for your tireless work in ensuring this series ran smoothly from start to finish. A special thanks to our National Working Committee for providing us with the opportunity for the webinar and the Zoom platform for the same. And finally, to our audience, thank you. Your presence, active engagement, the questions you have asked made this a truly interactive and meaningful learning experience. As we conclude this series, let us carry forward the knowledge we have gained. This is not the end of learning, but beginning. Our next month's session will be on learning disability by Dr. Anuparani, dates of which will be announced later. Thank you all once again for your participation and for making this series a remarkable success. Thank you.
Thank you very much, ma'am.
Thank you.